Welcome to another segment of our Partner Spotlight series, brought to you by the members of the Regional Chronic Disease Collaborative. The Regional Chronic Disease Collaborative members work together, combining their resources and expertise to help prevent the development and progression of chronic disease across our region. Our Partner Spotlight initiative is to help share innovative approaches being used throughout our region to improve population health. I'd like to introduce Jina Rojas, the Executive Director for the Diabetes Foundation of Guam. She is here today to share how they created a nonprofit organization to help provide services to support their patients with diabetes. Welcome, Jina.
Half a day. Thanks for having us.
You bet. Thank you so much. So, how would you like to share with our audience today how you created a foundation to address the needs of your patients in Guam?
It actually took a lot of planning and passion for us to get this started. It was just a core group of folks in our community who were doing work with diabetes and chronic disease already. And we recognized a need that was and some gaps of services that were lacking in our community, and we just went for it. The group got together, having discussions about what we wanted to accomplish, finalized what our mission would be, got our paperwork all started, and we just went for it. And we've had a fabulous first year. We started in January of 2022, filed our nonprofit status. We were awarded our 501c3. And we've already received 2 grants to get our foundation and our services off and running. So we're very proud of that. It takes a lot of work, but like I said, you can't do it without passion and having a great support system.
Yeah. And so really you saw a need in your community and didn't know any other method or, any other avenue to address it. So you created a foundation. And what were you hoping to accomplish? Like, why the need to create a foundation?
We really wanted to supplement what was already happening in our community. Our public health program, Diabetes Prevention and Control Program, had its programs already going, working with the Diabetes Control Coalition. There is a volunteer-run Guam Diabetes Association who provides screening and prevention services for the community, but there really was no formalized education offered to our community in various languages, in culturally appropriate languages, and especially to those who have no insurance or who are underinsured. And that was probably our biggest goal, was to provide education to those who really had nowhere to go.
Yeah. And I think what you mentioned earlier was that you create a foundation so you could go after some funding, and that funding would then allow you to create the services that you needed. Is that true? Is that correct?
Absolutely. Yes. As a coalition member, we recognized that there were no opportunities for us to do any programs with either local or federal funding. So forming a nonprofit who had the status to go after those types of grants and funding really is giving us an opportunity to expand services throughout the community.
Well, that's great. And what results are you seeing as part of this foundation that you created?
I think what we're learning throughout this process is that we're starting from the ground up. So we're at a base and a foundation now. We're recognizing some challenges that we're having, remodifying some of our program elements, recognizing that providing training for community healthcare workers isn't as easy as we thought it was, because there was no community health worker program in existence here on Guam prior to that. So we had to do a lot of research in how to start a community healthcare worker training. We looked at some national standards. We looked at other programs that were running stateside so that we could create something that would really make sense for Guam. We formed a partnership with the Pacific Chronic Disease Council, who's providing us with all the materials They did a lot of research in developing their curriculum called Navigating the Course of Diabetes. So that partnership really created for us the starting point for our curriculum. And then we just added on to it. We're doing continuing education, learning sessions for the community healthcare workers so that we're continually in touch with them and keeping them up to date with what's happening in diabetes education.
Great. And how are your services impacting your patients directly or the residents of Guam directly?
We're just now getting started. It took a few months for us to start recruiting participants into our program to kind of sell it, if you will. We needed a lot of organization to approach participants. We had difficulties finding venues to host the trainings that were centralized and easily accessible in a setting that's conducive to learning. So that's another challenge that we faced here. But for those who have completed the program, I think they just appreciate the opportunity to learn more about how they can manage their disease. A lot of people don't even realize that they were at risk for disease. Some people who are participating in the program who know they have diabetes didn't realize that there were other prevention tips that they could follow, or even the importance of going through a diabetes self-management and education course. So we're learning a lot in our first few months, taking notes and addressing some of the challenges, which you need to do when you're starting a new nonprofit, is to remain flexible. You need to adapt to any challenges that are coming your way, and being open to additional opportunities to change mid-course. So it's definitely been a learning lesson for us, but we're excited about it. We're excited about the changes that we're making. We're excited about new opportunities that are coming our way. And we're looking forward to additional grant funding so that we can expand our services.
That sounds great. So what advice would you have if somebody else was interested in this approach of creating a nonprofit to help develop services? What advice would you have for them?
Definitely know what your mission and your goals are. We conducted a strategic planning process with our board members and invited some community advisors to help us formulate what our organization mission would be. We understood that having a technical background is important. We didn't have a website, we don't have social media, which are all key components in promoting your services and getting your organization recognized. Starting from ground zero with having no data is definitely a challenge. So you'd have to rely on data from other sources to help you support the objectives and goals of your services. And then definitely do not underestimate your time when applying for grant funding. You really have to acknowledge the man hours and the support system and any other resources like hard assets that it would take to execute your programs and starting from scratch.
And what part of your program are you the most proud of?
I'm really proud of the fact that we started the community health worker training. Like I said, it was a workforce that doesn't exist here on Guam. There is another organization that provides kind of an overview of community health worker training. It's actually pretty intensive, but ours focuses mainly on diabetes and chronic disease, which makes us quite unique. So I'm really proud that we were able to get that off the ground. That we've started training a handful of community healthcare workers who are skilled to facilitate the programs and can help us bridge those gaps between our communities, our diverse community here, not only our native population of the Chamorro people, but our Filipino population, and especially our Pacific Islander populations. There's definitely some language barriers. So incorporating some of the class standards, the culturally and linguistically appropriate services into our program, I think is really what makes us effective. And I'm really proud that we were able to do that.
Well, that's great. And I want to thank you so much for the work you're doing in Guam and for being part of our Partner Spotlight series. So thank you so much.
Thank you, Patty.
You bet. Take care. If you are interested in sharing your innovative approach, please contact one of these Mountain Pacific representatives. Thank you so much.